everyone, welcome back to See the Stories. Now, this is a signature segment of our 3-hour news show. Today, May the 28th, it actually marks the Menstrual Hygiene Day, which emphasizes the importance of proper hygiene for women during their menstrual cycle.
In many developing countries, women often face challenges accessing menstrual hygiene materials due to availability and cost constraints. Now, additionally, social norms surrounding menstruation can further complicate matters. Research indicates that the lack of access to menstrual hygiene supplies can lead to girls missing school days during their cycle every month. Therefore, Menstrual Hygiene Day is a global advocacy platform for promoting hygiene management worldwide. Now, many women still struggle to maintain proper hygiene during their menstrual cycles. So, we want to know what are the correct methods to ensure hygiene during the menstrual period. And, to know more about the topic, we have obstetrics and gynecologist specialist Anggara Mahardika. Hello, doctor.
Hello, hi
Thank you
guys.
so much
Thank you for having
being
me here. Thank you for having me here.
So we're going to talk about something bloody, menstrual
Yes,
cycle.
it's very
Yes.
daring topic. It's very controversial, but
Yeah.
it's very important.
Why do you say it's daring? Because
Well,
is it a taboo?
Exactly. In some countries, especially here in Indonesia, when we're talking about menstruation, there are some people's actually like seeing this as a taboo and it's not appropriate to talk about.
Oh, wow.
And because it's very close-minded way to approach this, somehow is not being discussed that much. So
Yeah.
like this kind of platform, this kind of media is probably would be best to tell them what's actually the proper way in such a open-minded way.
Right, so we have to advocate more, campaign more on how to actually keep our hygiene during
Yeah.
menstrual
True.
days. All right, so first up,
Yeah.
let me go ahead with
Yes,
this.
go ahead.
Yani. 'Cause-
I'm ready to listen because, I have 2 girls.
Yeah.
And,
Exactly.
I need to know more so I can, teach them later on.
Yes,
Yeah.
perfect.
So can you tell us about menstrual cycle? What is it when it's considered as normal? And how long does it usually last? Some people go for like 5, some for 7, some even extend 7 days. So what is the normal situation for any menstrual cycle?
Okay, great.
Depending
That's
on-
a very good question. When we're talking about normal menstruation, what we have to consider is the amount, the frequency, and the duration. The frequency, let's say, the cycle is within 21 to 35 days.
21 to 35.
21 to 35 days, and it lasts, the periods
Yeah.
is only 2 to 10 days. So it can be 2 days, or it can last until 10 days.
That's the max.
That's the max.
All right.
And then the amount is around 60 cc or 60 milliliters to 80 cc. It's around 6 or 8 tablespoons. So if you actually measure tablespoon, that's around that much every episode.
All right.
So every episode. So if you're seeing your menstruation is quite a lot, heavy with clotting and messy everywhere, and you actually get out on your pants, that's probably abnormal. That's probably you should check.
Okay. What is the possibility? I mean, is it bleeding or is it something?
Exactly. There are a lot of probability that can cause that. Either it's the structure. For instance, there's this disease is called myoma, adenomyosis, or the hyperplasia of the endometrium, the thickening of the endometrium. That's the structure, or probably the function that's actually affecting the function of the ovaries, the function of the endometrium itself. That's a lot of possibilities.
Yeah.
Once you consider that this menstruation is no longer normal, it's no longer in that criteria that I mentioned before, then you should check.
So the first thing you have to teach to our daughters
Yeah.
is to keep the calendar.
True.
That's
And you have
very
to mark
important.
your
Mark it,
calendar.
yeah.
That's a very important. It's very common in the West.
Yeah.
They're always put it in their phones. So starting these days, and then the next month will be the other days. But here in Indonesia, this habit is not so.
Not yet.
Not so much.
Yeah, not so
adopted.
much. Not
so
so
it's
much.
based on the PMS. If you're like,
If you're moody and you're just
if you're like senggol bacok, that means you're about to have the
exactly.
PMS.
Yeah, right. I mean, like you know the time, yeah, the dates.
But it's interesting because you said the duration starts from 2 days to 10 days. Some people would think that 2 days is too short, but it's
No,
actually
it's
okay,
actually
right?
Okay.
It's okay.
It's okay. Well, there's what we call it. There's a pattern of normal menstruation. The pattern is that when you're having the first or the second day, the menstruation would be heavy.
Yeah.
This is the time when the endometrial line is shed
Open?
apart,
Thinning,
shedding,
right? Yeah.
shedding, as in like they're falling apart. Because due to the lower level of estrogen and progesterone during menstruation, right? And once they're shedding apart, and the uterine will contract. Once they're contracting, the blood flow, the menstruation will decreasing slowly by slowly,
Yeah.
and then you will see only spotting,
Yeah.
and then that's it. It's
And then
it's
gone.
gone. So
Alright.
the duration we can tolerate 2 until 10
10
days. More than 10 days, you having spotting like the 11th day or the 12th day, that's probably abnormal.
Then you have to go see a doctor.
Right.
All right, so let's talk about sanitary products because, oh goodness, nowadays there's so many different things that people
Yeah.
use, women use during menstrual cycle. We have pads, we have tampons, and lately, or maybe a few years back, they came up with menstrual cup.
Cups, yes.
So there's so
Still
many
up
more.
until now.
So out of all that, which one is the safest?
True.
Safest.
Okay, if you're asking me whether the safest or which one that you should prefer,
Yeah.
it depends on the needs or the preference of every woman. So let's talk it one by one.
Yeah.
Let's
The
start
most
with
common
tampons.
pads.
All right, let's talk about
Yeah.
pads. We have with wings, without wings.
Oh my God, yeah.
We have the night
The
type.
night long
Yeah,
one.
The night long one. There are a lot of, and then there's
Yeah.
also another that actually get the additional material like the antibacterial agent,
yeah.
the
Yeah,
natural
yeah, yeah.
agent.
Yeah.
We have lots of options these days in the over the counter or in the supermarket that you can choose.
Yeah.
What is actually matters is that you have to know what kind of skin that you have down there.
Okay.
Whether you're having such a sensitive skin, because the thing is, the skin down there is that, more or less it's like the face. It's very sensitive.
Sensitive,
So if you
okay.
can take care of your face, then you can take care of your skin down there as well. So you have to make sure that it's actually not containing something that can irritate the skin down there. You have to make sure that it's actually can you can choose whether you want to have a high mobility or you're actually very active. You have to choose whether it's actually suitable for you or not.
Yeah.
So there are lots of options that you have to try it one by one.
Okay.
That's for pads.
Pads, yeah.
What about tampons? We know that tampons is it's not very common
Yeah,
here
it's
in
kind of taboo
Indonesia,
here,
don't you think?
I guess, yeah.
Yeah. So tampons, you know this, it's cylinder type that you have to
Yeah.
insert in
Yeah,
the
exactly.
vagina.
Yeah.
The pros, it's compact. It's very light.
compact.
It's very
Right.
small. You can carry it around. It's suitable for swimmers. If you want to swim during menstruation, that's
Yeah.
also possible.
Yeah.
You can wear it. But then the cons, probably it may irritates. It may, if you're actually putting it not really well, your hands dirty or so on,
Yeah.
can cause infection.
On
That's
the-
for
on
tampons.
the wall of
On the wall or the vagina or the area down
Okay.
there.
Okay.
So that's tampons.
Yeah.
What about the cups? Usually it's actually
Yeah.
silicone based. It's also not very common. You have to insert it and you
Yeah.
have to put it out every 4 hours,
Yeah.
wash it and then put it in again. That's cups. And the other one is, if you know, there's this cloth. Like the materials is from clothing, so it's a reusable
Right.
pads. There's also
Okay.
this kind of
Yes.
pads that is actually being used in some areas because they want to go green and so on.
Right.
Yeah. Does it, okay, go green is one thing, but is it also because the sensitivity, as you mentioned, maybe is it safer compared to the...
I don't think it's safer
manufactured
because it's again it depends on the skin. The skin
Right.
can react to any materials.
That's right.
If you're actually type of skin that reacts to cottons, which is
Yeah.
the base material of that reusable,
Then it's a no-go
then
for
that
you.
is no.
Right,
So
okay.
again, it depends on which kind, what kind of skin, what kind of person you are.
Yeah.
Always see the packaging. There's always explanation on the packaging.
Oh, how do we know? I mean, this is very new. Like, my parents never taught me, okay, you have to figure out what kind of skin
Yeah,
down
yeah,
there
yeah.
you have, you know?
True.
Yeah.
So how do we know what
All right.
kind of skin we have?
The easiest way is that you can try, if you're actually having a hypoallergenic or hypersensitive skin, you can see the skin from here
Yeah.
or on the back of your neck.
All right.
If it's easy to get itchy
Yeah.
or you get redness or you have easily get redness. That means you have a sensitive skin.
Allergen.
Okay.
If you're having sensitive skin, make sure that the pads that you're choosing is either hypoallergenic.
Right.
Hypoallergenic means not induce allergy or inflammation,
Right.
or it's actually very safe for the skin, and it's usually the container stating that it's actually can reduce the risk of inflammation, something like that.
Right.
That's
Right.
probably one thing.
Yeah.
The other thing that probably if you're during your activity, you want to wear something that is actually bigger with
Yeah.
the wings.
Yeah.
Sometimes I have patients who's actually wearing a night type
Yeah. Nice.
during the
pad.
day.
For the
during
mornings.
the day.
Wow.
Because
afraid
she's
they
very
will,
active. She's like mobile, and
Yeah.
she thinks that it's actually could save, so she can
Move around
wherever.
more comfortably. But I mean, you mentioned that menstrual cups, you need to change it or wash it every 4 hours.
Yeah.
What about tampons and pads? Like, how often do we need to replace it with a new one?
Perfect. This is a very, very important question, and not every woman in Indonesia especially know that it is recommended to change it every 3 to 4 hours.
3 to 4 hours.
So whether it's
whether it's full or
stains-
not.
whether it's dirty or not, whether it's with
Oh,
stain or
okay.
not, you have to change it every 3 to 4 hours.
Because it's bacterial?
Exactly,
Or-
the humidity down there, the sweat. You can guarantee that you don't sweat down there,
And
right?
there's probably other discharge as well, other
Exactly.
than the menstruation?
Yeah, well,
The what?
it depends. Some cases actually can produce discharge during menstruation. Others is actually just pure menstruation. But what is actually interesting that some women, when they're actually having their pads,
Yeah.
and then they're going peeing, for instance, they're going
Yeah.
their business in the toilet. And then they're saying, okay, my pad is still clean, so I can still
They
wear
don't
it,
change
even
it.
though it's already 3 or 4 hours. They don't change. That's
Okay.
That's
something
the
that we
most
have to
common
change.
mistake. Yeah.
Change it, as well as tampons.
As well as tampons.
But I mean, in public toilets, when you want to wash it, you have
Yeah.
to get out and go to the sink. And I mean, it's how possible.
That's the thing.
That's another thing. How do we dispose it? Because our parents would be like, you have to wash it, but then nowadays it's like you don't have to wash it. You
don't.
just have to throw it away.
True.
And menstrual cups, you need to wash it, no?
Yeah, well,
Yeah.
For menstrual cups, okay, one by one.
Yeah.
Pads first, then all right. Okay. Let's do the pads.
The
okay?
pads and tampons. yeah.
How we dispose, how
Yeah.
we put it out.
Yeah. Just throw it away.
The important thing is when you actually would like to dispose
The
pads,
used tampons or pads.
yes, the
Yeah.
used one, you have to roll it up and
Yeah.
make sure that it's actually sealed.
Sealed.
You can use papers, you can use
Plastic, right?
tissue papers, plastic,
Yeah.
Right.
or anything. Make sure that it's actually sealed, and then you can dispose.
It's not left out, open.
Yeah.
No, never.
Yeah.
It could because it contains blood, which is actually bacteria-related diseases can grow in that part. So that's very unhealthy if you just leave it there.
Yeah.
So you have to roll it, and then you dispose,
Yeah.
and then you change the new one. That's why. For pads, it's not really compact because it's big,
Yep.
right?
Yeah.
That's the reason why people choose for married women especially because tampons can destroy the hymen, right, for virgin
Yeah.
women. So they're using tampons rather than pads because it's very small. It's
Yeah.
you can
Just
bring
put in your
4
purse.
Exactly.
Yeah.
Yeah.
But then for pads, if you're actually you have to make sure that if you don't. That's why maybe you can bring like bigger bags probably that can contain your needs.
Yeah.
So change it whenever, wherever that is actually important, 3 to 4 hours.
If for pads and tampons, you don't need
Okay.
to rinse it. You
Doctor,
just throw it away.
I need to ask you though, if we do not have water around, using the wet wipes, is it safe enough?
In order to wipe it after doing your business number 1, number 2, or what do you mean by?
When you want to change to the new pad, for example, and you are
Yeah.
in your menstrual
Okay.
days, and you want to change it, you need to clean it a bit, right?
Clean for your area, okay? And then?
Is it
which-
okay to
is
use
it
wet
okay to-
wipes?
It's okay.
Instead of water.
It's okay.
Yeah, it's all right.
Ah, okay.
Well, it's the best way is using water. That's the best way because the flowing water can definitely do. But if you don't find it anywhere, make sure it's just dry. Even just a tissue paper, it's possible. You just wipe it,
to be dry.
makes it dry. change your pads, and then you can wear it again.
We don't want any fungi. Or
No. The humidity down there needs to be preserved in such a right way. No.
Okay.
Yeah.
Exactly.
It's very interesting, right? So that's a lot of information that you
It
just-
is interesting.
Yeah.
I'm like
Right.
writing it down here, jotting it down. All right.
Yeah.
We need. Well, this one is very important too. So,
Yeah.
what steps should be taken if menstrual products cause recurrent urinary tract infections
Ooh.
or UTI?
I thought it's a different, like, sort of like,
Yeah, very true.
Tunnels.
Very
Yeah.
true. But that is very related, actually.
right.
Without the ostium, the hole when you're doing the peeing,
The peeing.
Yeah.
the peeing is we call it as urethra.
Yeah.
Urethra.
From the ostium to the bladder. For women, it's only 4 centimeters, so it's very
short.
short. So if you having bacteria or microorganism, which is actually normally flora normal, it's normal.
Yeah.
There's a bacteria down there.
Yeah.
But when you're having such an imbalance of bacteria, and bacteria right there is growing, it can goes up to the ostium from the whole ostium to the bladder, then to the urethra, and then to the kidneys.
so this is the urethra way.
Yeah, that's the going up urethra way. So usually the bacteria is Escherichia coli. So if you know the name, coli coming from colon. So coming
Right.
from the back,
Right.
from
Oh,
the
okay.
colon is
Yeah.
the back part of the
The
area.
other
Yeah.
one, yeah.
Yeah.
The thing is like this. The Indonesian woman tends to wipe their area in such a wrong way.
From back to front?
Exactly.
Or
From
just-
back to front.
just
or
washing
back
it
and
too.
forth.
Oh, back and forth, back
That's
and
not
Oh, you
also,
can't do
it's
that.
not recommended.
My goodness,
What you
yeah.
can do is you have to wipe it one way.
Front
One
to
way.
back.
Front to back. Front to back. Front to back. Just one way, always.
Yeah.
When you actually wiping from back to front,
You're
the
Yeah.
E.
spreading
coli,
the E.
yes,
coli.
yeah. And then
got it.
the UTI could occur.
Yeah.
That's the relation. That's number
Yeah.
one. The other one is that if you don't change your pads regularly,
Mm-hmm.
as it's recommended, the bacteria will grow.
Yeah.
And also because it's
Yeah.
very short, bacteria
It's
grows,
easy.
going up, bladder,
Yeah.
blah blah blah, and it's another.
right,
It's
right,
a urinary tract infection.
Keep it alone.
Yeah.
like, seclude them from everywhere else. Okay, so nowadays, as you mentioned, there are a lot of options, the wings, the flyaway and all that. What about the ones with fragrance? Do you think it's safe enough?
All right. Well, women is actually very concerned about this. Some women, especially. Vagina or intimate part of women is actually having such a distinct smell. They're quite tangy, sometimes metallic, but then jasmine and roses is actually none of them.
No.
Never
Not
natural way, jasmine
By
and roses.
Yeah.
the gimmick.
Yeah,
That's
but
not the
it's like naturally, your area down there smells like roses. Definitely, naturally, it's impossible.
All right.
And then some people actually invent these products to make sure that it's actually becoming fragrance. It's contain chemicals. Some of them actually contains alcohol, which is very dangerous. So you may not
Okay.
use something that is actually contain alcohol. But some people is actually okay with that. By means okay that they're using their product, no side effect, they can use it. But some people is actually, and which is most of the women who's actually wearing it, is having side effect, including inflammation,
Right.
irritation,
Yeah.
redness down there, itchiness down there after they're wearing that fragrance.
Right.
Yeah.
So my recommendation is that you have to make sure is will your body reacts to that chemicals? Will your body reacts to that fragrance?
Yeah.
So know your body well.
Yeah.
Exactly, and you can try it in your skin, upper skin, like in here or in here. That the skin that is actually quite sensitive to new chemical or new
Right.
things. Well, if there's no side effect, there's no redness, then you probably can wear it down there.
Right.
Yeah.
What about the hygienic other hygienic products? Like for example, soap. Do you have to use a specific soap for vagina? For
Yeah,
example?
perfect.
Yeah.
This a
Or
good
is it just
question.
normal soap?
Recommendedly, doctors recommends that you wash your vagina just only waters actually.
You're right.
Nothing else.
Nothing else, just only waters. if you want to use a certain soaps that usually they're actually trying to make it the pH the same as the vagina, which is 3.5 to 5. So it's quite acidic
Acidic.
rather than the other
Alkaline.
soap.
Yeah.
So they try to invent these products to make sure that the vagina having the same. You can wear it probably 3 to 2 times per week.
3, 2.
2 to 3 times
2
per
to 3
week.
times a week. Okay.
So not so often. Every day is not recommended. Just water.
okay.
That's why if you see the
But
organ,
they sell all the products though, you know, like only for
That's
your
right.
not
private
necessarily
parts.
every day, honestly, because
Okay.
the Almighty already make it very perfect with the yeah, you know what I mean.
Yeah.
It's close. It's from the front to the back. Such a lot of barriers, right?
Yeah.
And that's the natural way. That's the way of the body try to protect it.
Yeah.
So, what about if you're using regular soap for area down there?
Yeah.
Some women is actually experiencing what we call as imbalance of the microorganism, and causing such a there's a discharge
Right.
Yeah.
after wearing a regular soap because it's
That
very
can be
base.
caused by soap.
Exactly.
Oh, okay.
Because they think that it will clean.
yeah.
It will clean the area with
It
the
will make it
regular soap.
smelling nice and
Exactly.
Like rose.
But then it destroys the ecosystem down there.
Ah,
The
okay.
good bacteria and the bad bacteria, it becomes imbalanced. And once this is getting imbalanced, then ecosystem down there
Is ruined.
is ruined.
All right, we still have so many questions
God.
for Dr. Anggara here, so he's still going to stay with us here, and we will continue our talk after the break, so don't go anywhere.
Doctor, stay here. Don't go in.